Welcome all. Today we will see how to write a injury report of a patient. Beside this, we will also see what is the component of a injury certificate and what is the observation of a medical officer during writing a injury certificate. So let's start.
So it is a format of a injury certificate. At first the name of the hospital, then the department and the heading of injury certificate, then the headings is patient ID, name, age, sex and date, brought by whom, identified by whom, identification marks of the subject or the patient, brief history, then the injury types, then advice and the prognosis, and at last the signature and the registration number of the medical officer or the doctor. So now we see that what kind of history or the question can come in the practical exam. So it is a example of the question. Let's see or the history given in the exam. Let's see the question. On 18th May 2019 around 10 p.m. a civic police bought one male person named Sushil, age 36 years, beard the following ID mark: a black mole on the right ear lobule, one black mole in the left bony cheek, with the history of road traffic accident, traveling in a two-wheeler, and as a pillion rider and hit by a car and run over the car tire, left forearm. On the X-ray, there is a fracture on both bone on left hand with a laceration of her left forearm measuring 5 into 3 into inch into muscle deep. Write a injury certificate and opinion management in details. Okay, so this is the question. Let's start with the injury certificate. Okay, it is the history and we write here in this format. So let's start. As there is no proper patient ID given, we write it as at a imaginary patient ID. Okay, suppose the patient ID is RMC 1/23. Okay, RMC 1/23. It is a patient ID. It is an imaginary patient ID. Next is the date. So date is 18th May 2019. So 18/05/19. So it is the date. Next, name. Name, we know that his name is Sushil. Sushil. There is no title given, so we don't write the title. Then age. Age is 36 years. Then sex. Sex is male. Then brought by. We see that brought by the civic police. Okay, so here it is the civic volunteer or the civic police. And as brought by the civic police, here identified also by the civic police. If brought by the family or the family member mentioned in the question, we write that identified by the family or the civic police or the police. So here we write identified by the civic police. Next is the identification mark. We can see the identification mark 1, 2. So we write it 1 black mole on the right ear lobule. globule, and second is one black mole on left bony cheek. So these are two identification mark. Then the brief history as stated by the patient or the patient party. Here is patient and we write at briefly the question. So here we write the brief history. On 18/5/19 around 10 p.m. a person named Sushil was traveling on two-wheeler and hit by a car and ran over the car tire over left forearm and hand. It is the brief history stated by the patient. Now we write details of the injuries. Okay, so first serial number 1, first injury, we write that, let's see the question, that on the x-ray is the fracture of the bone on the left hand with a laceration over the forearm. Okay, so we first write the laceration. You can write the fracture first. So there is two types of injury, one fracture and the laceration. So we write first the laceration. So the laceration wound. Okay, and the measurement is 5 into 3 into muscle deep, means 5 inch in length, 3 inch in width, and depth is muscle deep, means it reaches up to the muscle. So we write as it is. So we have wrote it. And next is site of injury. Let's see the site of injury is the left forearm. So it is the left forearm is the site of injury. Then the age of injury. Next, the age of the injury. So we got it at time that 10 p.m. and when we examine, we don't know. So here we examine the wound. Okay, let's suppose the wound is reddish and margin are red. Okay, so margin and appearance of the wound is red, so it is less than 12 hours. So age of the injury is within 12 hours. Okay, so you have wrote that margin and the edges are red, so around 12 hours is the age of the injury. So next, the causative weapon. Causative weapon or the causative force is the blunt force. Here is the blunt force. Okay, as it is a road traffic accident, mostly there is and the tire and there is a car tire over the left forearm, so it is a blunt force. Next, we have to write whether it is grievous hurt or not. Grievous hurt is that any hurt which endangers the life or cause severe pain or unable to follow ordinary pursuits. Okay, so here it is also a life threatening. A road traffic accident is always life threatening, but here the subject faces severe body pain, so we wrote that it is grievous hurt, so we wrote it yes. Next, the next type of injury is the fracture. So next is the fracture. So the measurement. So we cannot measure the fracture, as in the question there is a term that fracture of both bone on the left hand. So it is the radius and ulna. So measurement is the left radius and ulna. Okay, so we have wrote it that left radius and ulna. As we cannot measure the fracture properly, so we mention the site. Then the site of the injury, we have to write that left hand. Next, the age of the injury. We cannot determine the age of the fracture, so as it is at the type of accident and the time of accident, but we don't need to write the age of the injury as it is a fracture. Then the causative weapon is also the blunt force, and it is grievous hurt absolutely, because there is a pain, so it is a grievous hurt. To give advice. So the advice, as it is a road traffic accident, we give a tetanus toxoid injection, then stitch the laser wound and betadine ointment apply locally. Okay, and we advise the X-ray. Here also X-ray is done and write it in the question, but we write it as advice. So we have wrote it that injection tetanus toxoid, stitch the lacerated wound, betadine ointment apply locally over the wound, X-ray of the left hand. Okay, then prognosis. Then the prognosis, we can write it is a good prognosis, but as it is hit the muscle deep and the also fracture occurs, so it is better to write the prognosis is guarded. There is two type of prognosis. Usually we write that guarded or the poor. So here not the poor prognosis, here we can write the guarded prognosis. Okay, so we write the prognosis is guarded. Next, the signature of registered medical officer or the doctor. So here is the signature and the registration number. You have write is your own name or own registration number. Okay, so that's all about the injury report. It is a very important topic of third professional MBBS exam of FMT.